Hello, my name's Sam Bevan. I'm a social worker and I'm here to talk to you about Lee. I qualified in 2002 and I've been working for local authority adult services since 2014. I met Lee in 2014 when he was 20. He'd been recently diagnosed with autism and a learning disability just a couple of years earlier. And there was, in terms of family, his mum, dad and an older sibling who was away at the time at university. As a child, Lee went to a school for children with special needs. Both his mum and dad worked full-time, and they said they hadn't needed any help from children's social care because they'd managed all of Lee's needs with help from extended family in Barnsley. And after school, a package of care was arranged for Lee that he seemed to really enjoy. He had a volunteer work placement on Mondays and a horticultural placement on Wednesdays and Fridays, and he also had a PA, personal assistant, who took him out on trips walking and swimming. And Lee seemed to really enjoy these trips out with his parents, PA, and out on placement. I also arranged for Lee some respite with Shared Lives carers because no matter how well things are going, everyone needs a bit of a break from time to time. It was in early 2015 when things started to go downhill. Lee's mum got in touch to say that he was hurting himself by hitting and banging his head, and he was also biting himself. And she was understandably upset and also worried because he was becoming violent and aggressive. I should have mentioned before now, Lee is quite a physical presence. He stands just shy of 6 feet tall and he's quite heavily built, and this must have been really scary for his mum and dad. Lee wasn't able to say what had changed to make him be like this. I was worried about Lee, but also for his family, so I arranged some respite just to give everyone a bit of a breather. I also referred Lee to the Barnsley Specialist Learning Disability Psychology team in the hope that they could help. Unfortunately, Lee was asked to leave his volunteer placement after becoming aggressive and smashing a cup. And things started to really go downhill. He refused to go to his horticultural placement and was becoming even more aggressive with his mum and dad. I arranged for him to move in with his Shared Lives carers because he'd never been violent or aggressive there. Sadly, after 2 weeks, Lee stabbed one of his carers with a knife. Thankfully, it was a blunt butter knife, but it was an unprovoked attack, and it could have just been so much worse if he'd happened to have picked up a sharper knife. Obviously, he couldn't stay there any longer after that, and Lee moved out that evening. An emergency placement was found for him in a residential home for people with learning disabilities. And by now it was becoming clear that Lee's autism was having a much bigger impact on him than any of us had thought. And with the help of the Barnsley Specialist Learning Disability Psychology team, I found Lee a specialist placement in Barnsley with another young man who had similar problems to Lee in 24-hour supported accommodation. He was in this placement for 8 weeks. And during that time, staff really struggled with his aggressive behaviour, and he was on extra medication most days. He was violent to staff and members of the public, and the police had to be called on several occasions. And there never seemed to be an obvious trigger as to what provoked these outbursts. I was worried for the safety of other people, but for 2 other reasons. Firstly, that Lee could get hurt by a member of the public as a result of his aggressive behaviour, and second, he could end up in prison where he would be in a really vulnerable situation. I had lots of meetings with all of those involved in Lee's care in an attempt to try and help him find a way to manage his anger and control his behaviour, but each attempt just resulted in him becoming more aggressive. As his social worker, I feel a real responsibility to Lee, and to some degree his family, who just want the best care for their son. I felt really out of my depth. Each time a new package of care, new service failed, Lee became more confused and ultimately more aggressive. It's heartbreaking. And eventually he was detained under the Mental Health Act and admitted to hospital. And because of his trouble with violence and aggression, it was a secure hospital, and it was a long way from friends and family in Barnsley because of the only one that had a bed and specialised in autism. And his problems with violence and aggression continued, and he was looked after in seclusion with the police attending when staff couldn't manage him. Obviously, this is not what I want or Lee's family want for Lee. He's a young man with his whole life ahead of him. But thankfully, in 2016, Lee was moved to a hospital closer to Barnsley, closer to friends and family, and there the staff seemed better able to support him. I'd be lying if I said it's all rosy. It's not. It's slow, but there is progress. I'm still very much involved in Lee's care, and I have regular meetings with the staff to assess his care and treatment on a regular basis. And I'm optimistic that one day he is going to be able to leave hospital and move back to Barnsley to live near friends and family with the right staff to support him. We have had a lot of pressure from NHS England to move Lee to a less restrictive setting. I don't think they understand the amount of work and thought it took just to keep everyone safe. Thankfully, we've got the beacon of the work that we did with our other young chap, Liam. He's now back in Barnsley in a supported living flat, so that will inspire us. But it's still going to require a lot of perspiration.